So my name is Dr. Dani Gordon. I'm a medical doctor and I practice in Canada. And I'm double board certified in family medicine in Canada. And in the US, I'm a specialist in integrative medicine. When I was in medical school, I dreamed of really helping people with a lot of chronic conditions, not just acute medicine, but my interest was really chronic disease, mental health, and all the little orphan diseases we couldn't really put into a box. Cannabis was something in medical school we were taught to fear, not to think of as a therapy, even though it was legal to prescribe it. How I really came to add cannabis medicine was a combination of my own patient journey with chronic pain and also really learning from my patients who were actually self-medicating with cannabis. And it was through a combination of these two factors that led me to get very curious from both an herbal medicine perspective and a scientific, evidence-based Western medicine perspective. I started realizing in my practice as a junior doctor that a lot of the therapies I was offering my patients were not really covering a lot of their symptoms and they weren't really getting much change. So cannabis is a really interesting medicine. It's also a botanical medicine with hundreds of different compounds inside of it. And these compounds then interact with our own endocannabinoid system. So our cannabinoid or cannabis system inside of our own very bodies. When I started using it with patients and choosing the different types of the plant and the different preparations and tailoring it to these symptom clusters, I was getting benefits and I was getting results with my patients that I had never seen before in 10 years of medical practice, using the best of evidence-based natural medicine and the best of drug therapy. One of the things that patients say to me on a weekly basis in my cannabis medicine practice is that this medication has helped them reclaim their life again in ways that they've never had from another drug. It's allowed some of my patients to wean completely off of opioid medications, fentanyl, morphine, benzodiazepines, these medications that cause a lot of disability and side effects, but people had no other choice. It's allowed people to return to work after years of disability and being housebound. I have patients say that they feel that they've slept well for the first time probably in their whole life. It's allowed my patients who were war veterans, who have PTSD, to really accelerate their recovery in their other therapies with using cannabis medicine as a tool. I feel like the future for cannabis-based medicines looks very bright. It used to be a perfectly respectable medicine. It's impossible to ignore the evidence that this is a very good therapeutic medication for many, many people.